So in this video, we're gonna look at how to study any disease, any disease. Of course, the study of diseases is called pathology, from pathos, meaning disease. So whenever you see a disease, or it can be even an infectious disease, I'll show you a slightly modified version of what I'm about to tell you to study how to study infectious disease. So this framework is something that you should have for your notes if you're a note taker, or in your head if you don't take notes or anything. It'll help you organize information in your head, or in your notes, to make life easier for you. So whenever you get a disease, you want to look at number one, general comments or general info plus epidemiology. Then you would want to go to the causes and pathophysiology. And once we understand the causes and the pathophysiology, I can give you an example. For example, in epidemiology, we would be thinking of, okay, so let's talk about Wilms tumor. And Wilms tumor is the most common cause of malignancy in children, right? Most common malignancy in the kidneys in children. So you would write that down because that's an epidemiologic fact, right? Another example would be lung cancer. Lung cancer would be killing the most people in the world when it comes to cancers. So you would write such information down in the general, and you could also explain what it is, what is lung cancer, or what is Wilms tumor, just few lines about that particular disease in the general info. And of course, then there's the causes and pathophysiology. What causes the disease, and how the disease process forms, which will come under pathophysiology. And then in line with the causes and pathophysiology, we should now be able to understand the signs and symptoms. So once we have understood the signs and symptoms, we can move on to laboratory ID, or laboratory identification, which can include, for example, X-rays or other imaging modalities, histopathology or histology, or even something as simple as blood tests, like a CBC, for example. So anything that goes to the lab, any lab, whether that's a biochemistry lab or histo lab or radiology department, anything. So that comes under lab ID. And the fifth would be treatment, of course. Treatment and prevention. Of course, this is pretty self-explanatory. If it's some kind of disease such as COVID, we would put use of masks and hand washing and hand sanitizing and so on, and prevention, and of course vaccinations. And number 6 is associated symptoms. And often in medicine we have associated symptoms, which means that we have not that important. Number 6 is not that important, but still we have some associated symptoms, or associated problems or symptoms or associated diseases. For example, often hypertension would have an associated obesity, or diabetes mellitus or something like that, associated symptoms that may or may not be related to the disease itself. So it's important to remember those things. And now when it comes to microbiology or infectious disease specialty, we can add certain things to this to make life easier. So whichever disease you're studying, you would try to put it in this structure, in this sort of structure, to make life easier for you, But in addition to that, what is important in infectious disease, in within the general info, you can include things like the worldwide distribution of the disease, worldwide distribution. So, for example, when you say COVID, of course, the SARS-CoV-19 or COVID-19, as we previously called it, SARS-CoV-2, we can say that it originated from Wuhan, but it has many different origins, but now it's also a pandemic, right? So we can say it has worldwide distribution. So where it is geographically, because usually certain diseases are located in certain parts of continents and certain parts of Earth. So we should look at that particular distribution, geographical distribution. And after that, we should look at the reservoir. So what I'm trying to tell you is like we're trying to zoom in, right? We start with the big picture, so the world, where it is in the world, and within the world, where is it within the world? So in the reservoir, for example, for COVID, we thought it was from bats, some kind of fruit bats, or any other animal, which we don't know yet. So we put down the reservoir, and then we zoom in again. So we move into mode of transmission. So how does the disease transmit between people, or how does it transmit from the reservoir? How does it get from the reservoir to the person, to the patient, to our patient? So this is transmission. So for example, respiratory droplets and aerosols would be COVID. Some chlamydia or gonorrhea would be a sexually transmitted disease, or hepatitis B or C could be intravenous drug use, or parenteral mode of transmission. So close contact with bodily fluids such as blood or semen, or vaginal fluid, or etc. etc. Just to give you an example. And after you looked at transmission, what's really important is the incubation period of that pathogen, whether it's a virus or bacteria or fungi or a parasite. What is the incubation period? So it is the incubation period is the time from the beginning of when you're introduced to the pathogen, and the time between when you're introduced to the pathogen and the time when symptoms start to arise. So it's sort of sitting in the oven, heating itself up to finally emerge as a disease in your body. So this is also important. For example, for COVID, an average incubation period is about 5 to 6 days. So this is also important. So when you study any disease, which includes infectious disease, try to put those informations, those data that you have into this framework. So wherever you read it from, whether you read it from Robbins Pathology or Pathoma, or wherever it is from, or the internet or Wikipedia, wherever it's from. So you sort of have to put it in this framework. This will make your life a lot easier. All right. That's all. If you have any suggestions as to what videos I should make on this channel, please comment below. Subscribe if you think my content is good. Consider subscribing. And thank you.